So good afternoon, everyone. To resume our topic on virology, we'll be discussing this afternoon about herpes virus. So we have the following generalities that the herpes viridae shares. When we say herpes viridae, it is the family of herpes virus. So they can develop a latent state, meaning to say they can go out again or reinfect you because they can develop into a latent state. Some members, like the alpha group, have a cytopathic effect on cells, which become multinucleated giant syncytial cells with intranuclear inclusion bodies. We call them as chunk. Okay? They are held at bay by the cell-mediated responses. So when we say latency, at primary infection, the virus migrates up to the nerves of the sensory ganglia and resides. The virus becomes dormant until reactivation occurs through some stress such as menstruation, anxiety, fever, sunlight exposure, weakening of the cell-mediated immune system. So with this condition, the virus migrates from the nerves to the peripheral skin to cause local destruction. Okay? So we also have the term called cytopathic effects. Cytopathic effects, or CPE, we have discussed this in our introduction to virology. Only the alpha group virus, like your herpes simplex, not simplex, simplex 1 and 2, and varicella zoster causes cell destruction. This results in the separation of the epithelium and causes blisters or vesicles. So your viral proteins are inserted into the host cell plasma membrane, resulting in cell fusion to form multinucleated giant cells. Both CMV from the beta subgroup and Epstein-Barr virus from the gamma group have less cytopathic effect. Okay, so this is an epithelial cells. As you can see here, this is a multinucleated cells. This is a multinucleated cells. Okay, indication of herpes. Still, this is a multinucleated cell. So patients with compromised cell-mediated immune response or immune status are more likely to suffer from severe herpes viridae infections, such as disseminated herpes simplex virus or multidermatomal zoster, or CMV frequently causes disease in HIV/AIDS patients. So for the viral morphology, it is icosahedral capsid enclosed by lipoprotein envelope. It has a tegument, an amorphous proteinaceous material that lies between the envelope and the capsid that contains virus-coded enzymes and transcription factors that are essential for the initiation of the infectious cycle. Although none of this is a polymerase. Take note, guys, all herpes viridae are DNA in nature or double-stranded DNA genome. Okay? So this is the morphology of herpes viridae virus. Okay? So for classification of herpes viridae, according to their biological characteristics, we have the alpha group, the beta group, and the gamma group. The alpha group is consists of the herpes simplex group. These viruses have a relative rapid cytocidal growth cycle and established latency in nerve ganglia. Both the HSV1 and 2 and BCV belong to this group. While the beta group or the cytomegalovirus group, these viruses have a relatively slow replication cycle that results in the formation of characteristics of multinucleated giant host cells, hence the name cytomegalo. For gamma lymphoproliferative group, this virus replicates in mucosal epithelium, where they also establish latent infections and induce cell proliferation in lymphoblastoid cells. So take note, home beta, there is cell destruction. Alpha, cell destruction. Beta, enlargement, hence cytomegalo. Gamma lymphoproliferative, there is induction of neoplasm or cancer. So for replication of herpes viridae, virus absorption and penetration, there is also viral DNA replication and nucleocapsid assembly, and of course, acquisition of the viral envelope latency. First, we will be discussing about herpes simplex 1. So antibodies to HSV1 are present in 90% of adults by their fourth decade of life, 40 years old and below, 40 years old and up, with those from lower socioeconomic classes are being more likely to acquire HSV earlier. So when there are clinical symptoms, patients will present with the following: gingivostomatitis, which is a painful swollen gums and mucous membrane with multiple vesicles. Fever and systemic symptoms can accompany the infection, and the disease will resolve in about 2 weeks. So there is also a reactivation. About 1/4 of the previously infected people have reactivation infection during stressed states. AIDS patient can present with severe reactivation of HSV. We also have herpetic keratitis sa mata, which is the most common cause of corneal blindness. Encephalitis, infection of the brain occurs with cell death and brain tissue swelling, and patients present with sudden onset of fever and focal neurological abnormalities, and of course, genital herpes. So here, herpes, this one, herpes, this one, herpes, slips, this one, also herpes. Encephalitis, and of course, this one, the vaginal herpes. This is also herpes. Herpes. Nasunog because of the irradiation. Okay? For simplex 2, genetically distinct from HSV1, is commonly causes a genital disease that is sexually transmitted. However, it can also cause oral skin and eye disease. That's why we don't separate HSV1 and HSV2. When we treat, okay, diretso na, both the same lang man ang antiviral medications, both have the same, quite the same symptoms. So the difference between HSV1 and HSV2 is not important medically for the reason that they have the same symptoms and treatment. So you have your genital herpes, you also have your neonatal herpes. Herpes, because during the delivery ni isang bata, gin-deliver sa isang nanay niya, naigo sa vaginal wall na may herpes, nagka-herpes man ang bata. Okay? Next, we have the varicella zoster virus. Varicella is your chicken pox. So as the name implies, it causes two diseases, the varicella or the chicken pox and the herpes zoster are called as the shingles. So varicella, after resolution, the virus remains latent and reactivation can cause the second disease, zoster. As with the herpes, the VZV can also migrate in the sensory nerve paths and cause vesicles. This is also known as human herpes virus type 3. Okay. So for varicella, this is highly contagious, infecting up to 90% of those who are exposed, normally in children. They usually occurs in epidemics, usually winter and spring, and involves children who have not been previously exposed. So the virus infects the respiratory tract and replicates for 2 weeks, followed by viremia. There is also fever, malaise, headache, are followed by characteristic rash that starts on the face and trunk, spreading to the whole body, including mucous membranes. The vesicles are described as dew on a rose petal or a red base with a fluid on top. So lalong, it is varicella or chickenpox. The shingles, however, are the zoster virus, herpes zoster. Following a stress state or lowered cell-mediated immunity, the latent varicella virus is in the sensory ganglion, begins to replicate and migrate to the peripheral nerves, usually in adults, and burning painful skin lesions develop over the area supplied by your sensory nerves. This is your varicella zoster. Okay. We all know that varicella happens normally on children, while zoster normally happens on adult. Varicella is itchy, but shingles or herpes zoster is painful. Varicella appears all over the body, while shingles only appear on the one area of the body, preferably may mga nerve endings. Okay. Next, we have cytomegalovirus. This is known as the human herpes virus type 5. The cell it infects becomes swollen or bigger. Thus, the name cytomegalovirus. So generally occurs in children depending on geographical location, and infections in children are mostly asymptomatic, and they continue to shed the virus for months virtually in all body fluids. Transmission is with intimate contact. Again, may I remind, intimate contact with the contaminated fluid, especially the saliva. So you can pass CMV to one another if you have one via kissing. Okay? So in adults, usually by sexual means, organ transplantation, and blood transfusion. That's why mostly in blood transfusion, dapat ang blood is irradiated or with filter. You might ask, Sir, ma-filter na isang filter ang ano mo, how? Ang CMV? No. But your CMV resides on white blood cells. If they reside on white blood cells, there is already a lesser tendency that it will be transferred to the patient. So latency and reactivation, there is a repeated episode of viral shedding over prolonged periods of time. Latency is probably established in the monocytes and macrophages and other cell types. So there is mononucleosis syndrome like your EBV, and symptoms of are the same as EBV or infectious mononucleosis with only the absence of heterophil antibody. So congenital infections are most common in uterine infection and referred to as cytomegalic inclusion disease. So infections of immunosuppressed and immunodeficient patients, CMV present in the tissue being transplant, and virus carried in leukocytes during blood transfusion. Also reactivation of the latent virus here. This is the cytomegalovirus. This is a cell with cytomegalovirus. Take note of owl's eyes. Okay, this is also an intrauterine product of CMV. Last, we have the Epstein-Barr virus. This causes the famous disease infectious mononucleosis and involved in certain cancers such as the Burkitt's lymphoma and other lymphoproliferative disorders in immunodeficient individuals. So for the epidemiology and pathogenesis, most transmission occurs in intimate contact with saliva with the virus, and the initial replication occurs in the oropharyngeal epithelium, and some progeny virus infects the B lymphocytes. The infection can also cause induction of a number of cellular lymphokines, including B cell growth factors. And in the early genes of EBV, in contrast, rather than cell death, is to induce cell multiplication and immortalization. As we all know, ang cells mo dapat wala last long. They tend to die. However, ang imong Epstein-Barr virus, gina-immortalize niya ang cells. Once ang cells mo na-immortalize, it becomes neoplastic rather than being replaced by normal ones. Okay? So for clinical significance, B cells are the primary target of infections due to the receptor molecule. So we have the infectious mononucleosis, oral hairy leukoplakia, the EBV and malignancies that includes your Burkitt's lymphoma, EBV-associated nasopharyngeal carcinoma, EBV infections in immunocompromised and immunosuppressed patients. This is an infectious mononucleosis that sa palat, basi may hara kananda, which is an infectious mononucleosis. This is the oral hairy leukoplakia, and this is the Burkitt's lymphoma. Okay, still with EBV infections, nasopharyngeal carcinoma, na nagdiretsyon na din, and of course your Hodgkin's lymphoma. So for laboratory diagnosis, a typical lymphocyte is seen in the peripheral smears. You can use the DNA or RNA hybridization, immunohistochemical techniques, whole Davidson test, heterophile antibody test, immunoblood assays, ELISA, indirect immunofluorescence test. So the treatment is usually acyclovir that inhibits EBV replication, but not that effective since it cannot kill immortalized cell. Okay, di ba ang cells mo, kung ano na sa cells mo, hindi mo na siya mapatay. Kaya protected na siya sa cell. Okay, next we have your central nervous system viral infections. So central nervous system infections are extremely serious. Meningitis affects the membrane surrounding the brain and the spinal cord, and encephalitis affects the brain itself. For the central nervous system infections caused by viruses, they can cause meningitis and encephalitis. Symptoms are usually start with fever and can progress to irritability, refusal to eat, and sometimes seizures. Diagnosis is most likely based on your spinal tap. Many infections are mild, but others are severe and can cause death. We can use antiviral drugs, which are usually non-infective, so children need to receive support measures such as warm and plenty of fluids. So we have 3 viruses that affect the central nervous system. We have the rabies, the arboviruses, and the enteroviruses. I will not discuss so much of the enteroviruses because we already discussed this on your exanthemas. The enteroviruses on your exanthemas and the enteroviruses here are just the same. Okay? So rabies, the rabies virus is a new neurotropic virus. Neuro meaning to say they want to infect your neurons. That causes fatal disease in humans and animals. The rabies virus has a cylindrical morphology, that's why bullet-like, and is a type of species of the Lyssa virus of the Rhabdoviridae family. So these viruses are enveloped and have a single-stranded RNA genome with negative sense. So as you have noticed, bullet-shaped ang mga virus or your Rhabdoviridae. Okay? So rabies is a viral disease that causes acute encephalitis in warm-blooded animals, mostly mammals with canines, your cats, your dogs, even bats. It is zoonotic and almost invariably fatal if post-exposure prophylaxis is not administered prior to the onset of severe symptoms. The rabies virus travels to the brain by following the peripheral nerves. The incubation period of the disease is usually a few months in humans, depending on the distance the virus must travel to reach the central nervous system. So, depende kung diin ka nakadaan. Kung sa tiil, medyo layo sa brain, pero kung sa liog, medyo lapit-lapit na. Okay? So once the rabies virus reaches the central nervous system and symptoms begin to show, the infection is effectively untreatable and usually fatal within days. That's why if you were bitten by an animal suspected with rabies, dapat as much as possible have your prophylaxis. Okay, so any warm-blooded animal, including humans, may become infected with rabies and develop symptoms, though birds have only been known to be experimentally infected. Most animals can be infected by the virus and can transmit the disease to humans. Infected bats, monkeys, raccoons, foxes, skunks, cattle, wolves, coyotes, dogs, mongoose, or cats present the greatest risk to humans, especially cats. Why? Because cats normally tend to lick their paws. So, baskin makarusan ka lang sa cats, may tendency na nga magka-rabies ka. Rabies may also spread through exposure to infected domestic farm animals like your groundhogs, weasels, bears, and other wild carnivores. Rodents are seldom infected. Seldom, but still possible. Okay? So the virus is usually present in the nerves and saliva of a symptomatic rabid animal. The route of infection is usually, but not always, by a bite. That's why scratch is still possible. Kung kiss ka sa animals, ay hindi man siya nang nakadireksyo sa skin at sa nerves mo. May tendency, kung may cuts ang imong mouth, so may tendency. Okay, always have it with a puncture. Okay. So after a typical human infection by bite, the virus enters the peripheral nervous system. It then travels along the nerves towards the central nervous system. During this phase, the virus cannot be easily detected within the host, and vaccination may still confer cell-mediated immunity to prevent symptomatic rabies. When the virus reaches the brain, it rapidly causes encephalitis. This is called the prodromal phase and is the beginning of the symptoms once the patient becomes symptomatic. Treatment is almost never effective, and mortality is over 99%. Rabies may also inflame the spinal cord, producing transverse myelitis. So early stage symptoms of rabies includes the following. May I highlight hydrophobia. Nabudlayan siya, nahadlock siya sa tubig because ang tendency is gusto niya mag-inom pero hindi niya matulon because ang iyang throat medyo hindi niya na makontrol. Okay? So the primary cause of death is usually respiratory insufficiency. So the signs and symptoms, the period between infection and the first flu-like symptoms is normally 2 to 12 weeks, but can be as long as 2 years. Soon after, the symptoms expand to slight or partial paralysis, cerebral dysfunction, anxiety, insomnia, confusion, agitation, abnormal behavior, paranoia, terror, hallucinations, and progressing to delirium. So the production of large quantities of saliva and tears coupled with the inability to speak or swallow are typical during the later stages of the disease. This can result in hydrophobia, in which the patient has difficulty swallowing because the throat and jaw become slowly paralyzed, shows panic when presented with liquids to drink, and cannot quench his or her thirst. So death almost invariably results 2 to 10 days after the first symptoms. The few humans who are known to have survived the disease were all left with severe brain damage, with the one recorded exception purportedly resulting from the implementation of the Milwaukee Protocol. So this is a human with rabies. Rabies. So diagnosis, you can have it by performing polymerase chain reaction or viral culture and brain samples taken after death. So the diagnosis can also be reliable made from skin samples taken before death. And it is also possible to make the diagnosis from saliva, urine, and CSF, but this is not as sensitive. Inclusion bodies, called Negri bodies, are 100% diagnostic for rabies infection, but found in only 20% of cases. If possible, the animal from which the bite was received should also be examined for rabies. We also have your post-exposure prophylaxis. It is highly successful in preventing the disease if administered promptly, generally within 10 days of infection. Okay? So in unvaccinated humans, rabies is almost always fatal after neurological symptoms have developed, but prompt post-exposure vaccination may prevent the virus from progressing. The blood-brain barrier during the lethal rabies infection does not allow antiviral immune cells to enter the brain, the primary site of rabies virus replication. This aspect contributes to the pathogenicity of the virus, and artificially increasing blood-brain barrier permeability promotes viral clearance. Opening the blood-brain barrier during rabies infections has been suggested as a possible novel approach to treat the disease, even though no attempts have yet been made to determine whether or not this treatment could be successful. Supposedly, I have a video wherein we try to get samples for identification of negative bodies. I'm going to send to you the video as well. Arbovirus, which means arthropod-borne virus, is a majority of the arboviruses, which are spherical in shape, although a few are rod-shaped. So they are 17 to 150 nanometers in diameter, and most have an RNA genome. Okay, exception is the African swine fever, which has a DNA genome. African swine, di ba? Concerned sa subong African swine. So these viruses do not normally infect humans, but if they do, they usually cause a mild infection such as a fever or a rash. Others, however, are epidemic and can cause serious infections such as meningitis and encephalitis that can be fatal. Usually, they stimulate interferon. So we have the following common arboviruses. Please study them as much as possible. Be familiar. Your arbovirus is called arthropod-borne virus. That's why the term arboviruses. Take note of the second column wherein kung ano ang ilang mga vectors. Ano ang arthropod nga nag-carry sa ila. Okay? You have your bunia, you have the rayo, toga. So you have the list of arboviruses of medical importance. Mosquito-borne disease, chikungunya, we have that last 2013, 2016. Rift Valley fever, equine encephalitis, dengue fever, Ross River virus, West Nile virus, and of course yellow fever. Tick-borne, phlebotomine fly-borne, and I will be discussing exotic viruses next week. Okay, if you have any questions, please feel free to send your questions through our group chat. That's all for now. Bye.